So if you're taking doxycycline for syphilis, you're probably wondering, how long until you're actually cured? So the truth is, it depends on how long you've had the infection. So even if your symptoms disappear, it doesn't mean that the bacteria is gone. So in this video, I'll walk you through what to expect during treatment and how long it might take. Hi, I'm Dr. Fuller, medical doctor as well as certified sex therapist. You don't have to figure out DoxyPep alone. So we've put together a full playlist of everything you need to know. So now we're going to look into the doxycycline treatment by syphilis stage. So there are 4 stages of syphilis, and depending on the duration, that's typically how we'll treat them. So first we have primary syphilis. This is usually defined when the first sore appears, typically within 10 to 90 days after exposure. So for primary syphilis, we're typically prescribing doxycycline 100 milligrams for 14 days. With this dosage, we typically see symptoms resolve within a couple of weeks, and you will typically be fully cured within 12 months. Second, we have secondary syphilis. This is defined after about 2 to 6 weeks after the first sore appears. In most cases, primary, secondary, and early latent syphilis are prescribed the same dose, which is doxycycline 100 milligrams for 14 days. You should expect to be 97% cured within 12 months. Next step, we have early latent syphilis. Early latent syphilis are different because there's typically no symptoms. So what defines early latent syphilis is that you've been infected in the past 12 months. And this is usually confirmed through blood work and your own previous sexual history. Early latent syphilis is treated with doxycycline 100 milligrams daily for 14 days. And you can expect to be 91% cured within 12 months. Last, but certainly not least, we have late latent syphilis or latent syphilis of unknown duration. This means you were infected over a year ago or at an unknown date, and you probably didn't realize because there are no symptoms. So for late latent syphilis or syphilis of unknown duration, we typically prescribe doxycycline 100 milligrams anywhere from 28 days to 30 days. And you can expect to be cured around 79% at 12 months. So typically we're going to prescribe doxycycline for a longer period at late latent stage. Unfortunately, we don't know how long you've had it or how long it's been building up in your system. When will you be considered cured after taking doxycycline? After you complete your course of DoxyPep, you can resume sexual activities and you will no longer be contagious, but you're not yet considered cured. So we would define a cure by a decrease in your blood test numbers. And we typically want to see a decrease by 4 times. So in the primary stage, this will typically take about 6 months. In the secondary stage, this will typically take 6 to 12 months. In the early latent stage, it can take up to 12 months. In the late latent stage or the unknown duration stage, it can typically take up to 2 years or longer. So typically we would need to do blood tests, such as an RPR or a VDRL. So this should typically occur within 6 to 12 months for primary, secondary, or early latent syphilis. We would typically do testing within 12 to 24 months for late latent syphilis. We also want to check to make sure there are no new symptoms, no clinical signs of active syphilis, no rashes, no ulcers. We also want to check and make sure that there's no reinfection, no new exposure, or positive testing. So why is it important to confirm a cure after syphilis treatment? So confirming a cure after syphilis treatment is important to ensure the infection is fully cleared. You want to prevent any long-term complications such as cardiac damage or neurological damage. You want to avoid spreading it to other partners, and you want to detect reinfection for treatment. So like I mentioned earlier, you will no longer be contagious and continue your sexual activity, but confirming a cure is about protecting your future health, not just your sex life.